It strikes millions of women, interrupts their sleep, and keeps them from enjoying their favorite activities with family and friends. Overactive bladder is a major issue in women's health. Characterized by urinary frequency, urgency, and even leakage, overactive bladder is an embarrassing problem that's impossible to ignore.
Overactive bladder is a terrible feeling for a woman. Overactive bladder is defined by a feeling that's called urgency. And what that is a sudden, compelling need to rush to the bathroom, or the woman's going to wet themselves. So it can be devastating, and it really sort of interferes with all of the normal activities that a woman may experience. So for women who are in the middle of a meeting or doing a presentation at the work, they have to leave that meeting or that presentation, or they're going to have a problem. And even for women who are doing pleasurable things, such as shopping or going to a movie, they've got to leave the movie or rush to the bathroom in the mall, or they may have a big problem.
30 million women, most of them over the age of 35, are afflicted with overactive bladder, or OAB. Yet many won't discuss it with their doctor, and may even think that frequent urination or incontinence is a normal part of aging.
It's normal to urinate approximately 8 times a day. Most people know what's normal for them. And the definition of overactive bladder really just says if you're going more times than you feel is normal. Also, you should never have to feel the need to rush to the bathroom or you're going to wet yourself. And finally, once you go to bed at night, you shouldn't have to get up in the middle of the night to urinate. You should be able to sleep through the whole night comfortably.
OAB occurs when abnormal nerves send signals to the bladder at the wrong time, causing its muscles to squeeze without warning. There are many treatment options ranging from behavioral remedies to exercises and even surgery.
Behavioral changes can significantly help a woman with overactive bladder. Some of the first things that a woman might do are commonsensical. Stop drinking so much water, things of that nature. Certain foods can irritate the bladder, such as caffeine, perhaps alcohol, and cigarettes. And finally, there's a whole host of interventions called behavioral therapy that a woman can attempt to try to ameliorate the symptoms of overactive bladder. And those include things such as pelvic floor muscle exercising, timing your voids, and suppressing the urge to urinate when it comes along. Surgery is really an option of last choice for overactive bladder. It's rarely done anymore, and for the most part, between behavioral therapy and/or medication therapy, surgery is usually not necessary.
In recent years, researchers have developed several medications to treat overactive bladder. For many women, these drugs are the right choice when behavioral changes aren't enough and they don't want to undergo surgery.
Medications work in overactive bladder to soften the symptom of urgency. Urgency is a compelling symptom that you have to rush right away. The brain is sensing that the bladder is having a big problem. What these medications do is they mute that feeling so that the women or the patients involved with overactive bladder don't have that severe urgency sensation. Anyone with overactive bladder who has failed behavioral therapy is a good candidate for overactive bladder medications. In general, they're safe and they're fairly effective. It's very common for women with overactive bladder to feel embarrassed, to not want to go see a doctor. There's a certain stigma associated with this disease. In fact, women of a certain age feel that it's naturally associated with just getting old, and that's not true at all. So the advice that I would give to them would be to be honest about their symptoms and go and talk to their physicians. Physicians these days are much well attuned to the disease state and the treatment options available.
Esprit Pharma is a pharmaceutical company dedicated to women's health. Esprit Pharma produces some of the most successful medications improving women's lives today.
Esprit Pharma has 3 main goals. Our first one is focused on our customers, the patients. We want to continue to provide them with quality, safe, and effective medications. The second goal focuses on our investors. We recognize the trust that they've placed in our company and in our management team through their investment, and our goal is to protect and safeguard that investment for them. Our third goal is to provide a good working environment for our employees. We feel that we can more easily reach the first and second goals if our employees are happy and well cared for. By providing them with opportunities to continuously grow and flourish and reach their full potential, we're a much better company, and our investors and our customers are well served in the end.
One of Esprit Pharma's premier treatments is Sanctura, a treatment for overactive bladder. Sanctura relaxes the muscles surrounding the bladder, reducing or eliminating the sudden onset of urgency associated with OAB.
Sanctura is unique as a treatment for overactive bladder. It has unique chemical structure which none of the other medications out there have. It's equally as efficacious as all the other medications, if not a little bit more so, but it's safer. It's associated with less central nervous system side effects, such as hallucinations and forgetfulness, and also it's not associated with any type of metabolic drug-drug interactions.
Using Sanctura, women can experience meaningful improvement in urinary frequency, urge urinary incontinence, and urgency severity in 1 week. Side effects associated with Sanctura are minimal.
These women are fairly miserable and they want to get better quicker. Sanctura can work as fast as day 1 to stop women from wetting themselves. And also, a number of these medications, patients don't persist on them all that long. In general, patients go off these medications after 4 to 6 weeks. Patients tend to stay on Sanctura because of its low side effect profile.
Thanks to Sanctura, millions of women can experience relief from overactive bladder, and Esprit Pharma will continue its commitment to women's health.
The future of Esprit Pharma is exciting. Hopefully, we will one day be the preeminent pharmaceutical company in urology and women's health care. When physicians in these therapeutic areas think about a company that's there to help them and to focus on them, they'll think Esprit Pharma. In the meantime, we hope to continue to do a great job marketing our current product line and look to in-license new and innovative therapies that serve these marketplaces.